Well, welcome to the show, Terri and Lindsey. It's such a pleasure to have you here.
Thank you. Thank you
You're
for inviting
welcome.
us.
You're welcome. Well, I'd like to begin by telling our viewers a little bit about your education and your background. So let's start with you, Terri.
Okay, well, I'm a registered dietitian and I work for Morrison and I'm the regional clinical nutrition manager. And I've been at the Brunswick Hospital for the past 3 years. But my original studying began in Canada because I'm Canadian, and then I did my undergraduate at ECU.
Oh, I didn't know you were Canadian. That's interesting.
From Nova Scotia. And so I work at the hospital, and then I also work at a private practice in Wilmington with eating disorder patients.
Wow, that's interesting. And so you've brought Lindsey here with us today. And Lindsey, I understand you're an intern and you're working with Terri.
Yes, ma'am. I'm a distant student at Lenore Ryan University in Hickory, North Carolina, doing my dietetic internship with Terri for a total of 9 months until May. And when I'm finished there, I'll sit for the registered dietitian's exam.
Well, great. It's just a pleasure to have you guys here, and I'm excited to get started. So, Terri, now I know you said your role at the hospital, you have three separate roles. I wonder if you could elaborate on that a little bit.
I do wear multiple hats there. I just recently got promoted to the regional clinical new manager position. So I am responsible for 6 other hospitals taking care of all their dietitians.
Oh, wow. That is a big responsibility.
It is a big responsibility. But I'm also the clinical nutrition manager at the Brunswick Hospital. So I'm in charge of all of the clinical medical nutrition therapy for all the patients there. And I'm also the patient service manager. So anybody in the kitchen, I help them make sure that all the patients get great service. So those are my big roles there.
Yeah. And what's your role in all of this, Lindsey? Everything else that doesn't fall into those 3 categories?
Much. No, I have 3 rotations to do. I have a food service administrative rotation, then I have a community nutrition rotation, and then a clinical nutrition rotation. I'm finishing up my food service now. I'll start my community next week, and then after the new year, I'll start my clinical rotation, and then I'll be finished.
Well, great. Terri, I'm curious, when a patient comes into the hospital, how do you determine what type of diet that particular patient might get?
Okay. Well, typically the doctor is going to prescribe a diet, and it's usually based on their disease state, meaning do they have diabetes, do they have heart disease, do they have any kidney or renal problems? And once those diets are prescribed, they go into our kitchen, and when a patient calls down, we have a program called Dining on Call, which patients can call basically like room service, and our Dining on Call associates will help them choose foods that meet their diet criteria. And it's really important for those patients to follow that diet because it's actually helping in their treatment. It's like medicine, so we kind of view food as their medicine. And we also follow up through their stay by providing education, so hopefully that they're going to follow through with those tips when they get home.
Well, now you mentioned Dining on Call. So are they given something to follow? Do they choose from a list of foods that are appropriate for them?
Well, we do. Our menu right now is like a room service, so they do receive a menu in their room. And when they read that menu and they call the number, the Dining on Call associates will let them know if it meets their diet criteria. So a diabetic will only have so many carbohydrates they can choose for a meal, and a cardiac will only have low sodium choices and low fat choices to choose from, and our associates will help them kind of look through the menu and see what's right for them.
And if they had a question about what the offerings, would they be able to talk with you if necessary?
Absolutely. All patients have the ability to request a visit with a dietitian, or even if they pass it on to the Dining on Call associates, they'll let me know, and then I'll go up and do a visit with the patients and help them out.
Well, that's good to know. That's good to know. Now, oftentimes you see on TV all these advertisements for these supplements, and I won't mention a product, but is that an option at the hospital? Would there be times where a patient might have to have something like that?
Absolutely. We always want to do food first. It's always the best. But there's times when patients, they can't eat by mouth. Maybe for some reason they maybe had stomach surgery, or the doctors don't want them to eat and let their stomach rest for a few days. So sometimes we do what we call enteral feeds, where they may have a tube placed in their nose or in their belly, and we give them supplements or nutrition to help them heal from whatever they're at the hospital for. But other times we don't want to use their tummies at all, and we are going to use what we call TPN, which is total parental nutrition, or PPN, and that goes through one of their veins. So you don't actually feel yourself being fed like you would with the other products, but it's really important that patients receive that to help shorten their stays at the hospital, because good nutrition is really one of the first defenses in getting people out quickly.
And when you say that, I envision this milkshake going through this tube and
Some of
into
them do look like
their
milkshakes.
arm. And I'm curious. Oh, it's so some do have
Some of the
color and
some of the products can actually be taken either orally or through the tubes. Now, the ones that go into your veins, those are specific, and they only go into your veins. But there are
Right.
other products that have different flavors and textures and tastes that can be used for all sorts of reasons. And more interestingly, some of them now can actually be used in baking and making meals.
Wow.
So if people get bored with just drinking like milkshake type drinks, you can bake with them like muffins or cookies or soups, and get a little creative with what you're having.
Well, I'm curious, and this may be a dumb question, but if a patient is hungry and you feed them by one of those methods, do they feel full?
If we're feeding them through a tube, either in their nose or the belly, yes, because it's going directly into their stomach, and they will feel that sensation. However, when you're feeding them through one of their veins, they don't feel, and that's kind of difficult for some people because they still may feel hungry even though we're giving them the nutrition, but we're not allowed to use their stomachs. We call it gut rest.
Oh, and there would be, like after surgery, a big belly or surgery, you might have to rest
We
the
really
gut,
have to rest that gut. And it may be for a short period of time, but sometimes people are on them a little bit more indefinitely, and it could be up for several weeks depending on how well they're healing.
So no pumpkin pie for them? Or
No pumpkin pie
no
for them.
pecan pie?
We do have some flavored pumpkin supplements.
Really?
So just like you'd go get your pumpkin latte or spice latte from Starbucks, sometimes we can doctor them up and so they're a little bit more tasty for patients.
Well, I'm just used to seeing those things on TV about Ensure and all those products that you drink, and they all look so young and stuff, and they're drinking Ensure, and I'm thinking, I should just eat something.
It's tough. For patients that don't want to eat, these are a great
I never
alternative.
thought of that.
This is a great alternative because most of them are typically high in calories and have a lot of nutrition, so they don't have to eat or drink a lot to get what they need. So that sometimes is a great substitution. Sometimes people just need a little bit extra, like our cancer patients. So those are just helpful. And they are supplements. They're typically not in place of the rest of their actual meals.
Well, we're happy to have both of you on the show today, but we specifically wanted to talk about healthy eating during the holidays, which are just around the corner. So I wondered if either of you could give us some tips about healthy eating during the holidays.
Sure. The main thing is just to be aware of what you're eating and plan ahead. If you know you're having holiday parties or whatever, just plan ahead and consider that into your whole day, not just that meal. Don't go to the parties starving. Try to snack before you get there. Be aware of your portion sizes. And one thing I think a lot of people don't think about is don't drink all of your calories. Those holiday punch and those things eggnog can really add the calories quickly. So just be aware of what you're eating or drinking.
Yeah, we go to parties and we see all that luscious stuff and we just start snacking and one thing leads to another and you've eaten 3 meals.
Three meals in one meal, absolutely. That's very typical on Thanksgiving. We usually typically eat more than a day's worth of calories in our Thanksgiving dinner meal. So we want to remember that we want to keep it simple and space those out throughout the day.
Just don't eat all day except for
Don't
that
eat all
one
day.
meal, right? Well, Terri, what might be some healthy alternatives for some of our favorite traditional foods, like at Thanksgiving, as you mentioned?
Absolutely. One that we like to do, instead of the green bean casserole, which everybody loves, is maybe substituting some sautéed green beans. You can save probably about 300 calories by just switching that recipe up. Also, another favorite, instead of the pecan pie, is going to pumpkin pie. And you're also going to save about another 150 to 200 calories per slice.
Wow.
And I know that Lindsey had just mentioned about the alcohol. One good tip is just switching between an alcoholic and a non-alcoholic beverage throughout the day. Because like Lindsey said, it's really easy to add those calories up quick. A few other ones would be with turkey. You may want to eat your white meat and not your dark meat. There's a little bit more calories found in your dark meat.
Well, my favorite thing is stuffing, though.
That's a tough one. It comes in with all the extras that you're adding into your stuffing. So if you're adding in a lot of dried fruits or nuts, you just want to make sure you're not going overboard because they add a lot of calories in a really small package.
And you can also substitute sometimes in certain recipes chicken broth for the butter or the margarine. depending on the recipe, especially like mashed potatoes, you can use chicken broth instead of butter and milk.
Yeah, I love stuffing. I mean, I could make a meal on that. And I love pecan pie. So
I know, that's a hard one. So maybe you just want to go with a smaller slice.
Yeah, because pumpkin, I'm thinking not.
It's not your favorite.
It's not my favorite. Not my favorite. Well, let's talk about after Thanksgiving and after Christmas comes New Year's. And we all start out with January 1, we're going to go on a diet. And by January 5th, we're done. It never works. So, how can you help me?
Well, I think the best thing is to start before Thanksgiving and not really think about losing weight over the holidays and more maintaining your weight. So if you go with that philosophy, hopefully the New Year's, you're not starting off backwards. But when you get to the New Year's, just remember we're doing small steps and make your goals really achievable. So if you're aiming for a 20-pound weight loss, we may only want to start with 5 and see how we do. And working with a buddy is always really helpful.
Yeah, the holidays, I'll always lose weight before the holidays. Then I put it right back on during the holidays. And then January 1, I got to start all over again. So it's not working for me. I need a new plan. So, well, thanks again for being here. I hope you'll come back and join us.
It was a pleasure.
We'll go through another great topic.
That's wonderful. Well, happy holidays.
Thank you.
Thank you.